I'm Vidika Shah, a final year finance, accounting and management student at the University of Nottingham. And today I'm going to give you a few important tips and tricks to make sure that you have understood the healthcare system in the United Kingdom. Tip number 1. Make sure you register with your GP as soon as you arrive to university. A GP or a general practitioner or a family doctors are the first points of contact in case of any medical assistance required. You can set up normal appointments just to get yourself checked or your health checked in cases of emergencies or just in general. There are 2 general practitioners or family doctors available for University of Nottingham students based on campus. One of our GPs is based on University Park, primarily for University Park students and Jubilee campus students, and this is called the Cripps Health Centre. The second GP available to students is on Sutton Bonington campus called Orchard Surgery. I would also like to point mental health and sexual health care services are provided for free by the NHS. Tip number 2. Please ensure that you have been vaccinated by the required vaccines for your country set by the university guidelines. This is extremely important to ensure that everybody that arrives on campus is safe, healthy, and fit. I would also highly recommend that you bring a vaccination card that states what vaccine you've gotten and when, to ensure that there's no confusion made in the future. During Freshers Week, the university provides the students with basic vaccines such as MMR and meningitis. If you have not been provided with these vaccines, you will be provided with them at the university during Freshers Fair. Please ensure that you receive these vaccines if you haven't already before during Freshers Week. Tip number 3. Please make sure that you only call 999 in cases of an emergency. If you call for an ambulance and it is deemed to be unnecessary, you may be charged for the ambulance. In order to avoid an unnecessary fee, I would highly recommend you first call your GP in case of an emergency. If they are unable to help you, then call 111. 111 is responsible for any non-urgent medical assistance. If this service is unable to help you, they will then request you to contact 999. Tip number 4. Always make an appointment to see the GP before you go. This can be done so online or on the phone with your GP. Tip number 5. If you're going to the hospital for yourself or just assisting someone else, I would highly recommend you go prepared. Waiting lines at the hospital or at the A&E are generally quite long, so I would recommend you take a phone charger, headphones, and all important medical documents that might be required by the doctor that is seeing you. This includes your NHS number. It is not mandatory for you to have your NHS number on hand, but I would highly recommend it because it speeds up the process to find patient information a lot faster. Tip number 6. Depending on where you are in the city, please make sure that you are well aware of the closest hospital to you. We have 2 primary hospitals in Nottingham, one called City Hospital and 2 Queen's Medical Centre. And my final tip, if you're not happy with the services provided to you by your GP, you are more than welcome to change your GP. To find the closest GP to you, just type on Google GPs near me and you can request a transfer for all medical services from your old GP to your new one. Down below, we have added some useful links filled with information that may help you clarify any doubts or any questions that you may have. Congratulations and welcome to the University of Nottingham.